What does the birth process have to do with your child's sensory processing issue? One of the most common things we see in our office is kids who struggle with a sensory issue also had a difficult labor or difficult delivery. What can happen is, as we know with a newborn baby, their neck is so delicate. And the birth process is pretty intense on a newborn baby. There's actually 60 to 90 pounds of pressure needed to push a baby through to be born into this world. And what can happen is, as that pressure is happening, it doesn't take much extra twist, turn to start to affect the baby's neck. Maybe your delivery was going well and all of a sudden it stalled. And each contraction now suddenly is putting immense pressure on your baby's neck because they're not going anywhere. Or maybe you had to have an emergency C-section. Things were going through one way and all of a sudden had to be pulled back out the other way. Or a lot of C-sections, especially if the baby's breech, is the baby might be pulled out by his head to get into this world. And all those things are great to get your baby out into the world, get them safely delivered, but a lot of times no one ever takes a step back to look and say, wait a minute, what just happened to my baby's neck here? And the reason the neck is so important, not only is it the most vulnerable because it is so delicate at a young age, but all the nerves from the brain pass through the neck to get anywhere else in the body. And all the sensory input going into the brain has to go into the brain stem before it goes up into the brain. And the brain stem is actually surrounded by the top bones in the neck. If those get shifted during delivery especially, what can happen is now the brain starts to feel under stress more than it should. So the most common thing we see with the kiddos that we work with a sensory issue is actually something going wrong in their upper neck. And some of the clues you might look back and recognize would maybe be if your baby was really colicky or fussy, if they had a lot of reflex. Maybe they were able to nurse on one side really well, but not so well on the other side. Those are some of the clues that we look for in our office that help us identify what's going on. As your child got a little bit older, we'll see kids with a lot of ear infections or trouble sleeping. Maybe their sinuses or congested, or they always get colds. All those issues actually can be stemming from the upper neck. That's one reason that we specialize in adjusting that area very gently, very safely, but it helps your child's brain suddenly start to communicate with his body better. If your child's working on therapies, what we'll see is that as your child gets adjusted, if there is something going wrong here, that suddenly your child's progress through therapies goes so much smoother. So that's the biggest thing we recommend is if your child has a sensory issue and they've never been checked by a chiropractor before, at least get them checked to see, well, maybe that was the culprit that sort of started everything in your child's life. So by addressing this, it helps them get beyond the hump or beyond the hurdle or the plateau that they're in and lets their brain and their body communicate effectively so that they can get through the day so much easier.